Our top focus this hour, the U.S. Health Secretary Alex Azar has said that the country could start its mass vaccination program as early as Monday. This comes as the country awaits an approval of the Pfizer-BioNTech coronavirus vaccine. The Health Secretary gave the news to U.S. TV networks after an expert committee convened by regulators voted to grant the two-dose regimen emergency approval of the Pfizer vaccine. Alex Azar also said that the authorities are working with Pfizer on logistics, and once the vaccine gets a green signal from the FDA, the federal government's Operation Warp Speed program will oversee its distribution to thousands of sites across the United States. But before this, a committee from the Centers for Disease Control and Prevention, that is the CDC, also has recommended the vaccine, as in it also has to recommend the vaccine. And the U.S. hopes to immunize about 20 million people this month, 100 million by February, and the whole population by June. Next week, the FDA's committee will meet to consider the second vaccine developed by Moderna. Both front-runner vaccines are based on new messenger RNA technology, which has never been approved before. Hospitals across the United States are prepared for their first vaccine shipments as they are waiting to get their hands on the authorization of the vaccine being developed by Pfizer and BioNTech in the country. Planning the mass vaccination program has put up several logistical challenges in front of the authorities, and particularly for the vaccine developed by Pfizer, which needs to be stored at a minus 70 degrees Celsius temperature. The state health departments are preparing hospitals for the Pfizer vaccine, which is to be stored at this temperature. To avoid spoiling, the health departments have also prepared a plan for the transportation of the vaccine. U.S. President-elect Joe Biden welcomed the news of U.S. experts recommending granting emergency approval for the Pfizer-BioNTech COVID-19 vaccine. Addressing the nation, Biden said that the people must have confidence in this vaccine as it is being produced with no political influence.
The FDA committee, recommended emergency use authorization for Pfizer's BioNTech COVID-19 vaccine. But we're grateful for the scientists at these, not only there, but other great organizations, researchers who developed this vaccine and several others on the way. And we're just as grateful to the scientists and the public experts who evaluated its safety and efficiency free from political influence. I want to make it clear to the public, you should have confidence in this. There is no political influence. These are first-rate scientists taking their time, looking at all of the elements that need to be looked at. Scientific integrity led us to this point.
Meanwhile, in New York, local authorities have now introduced new restrictions to tackle a fresh surge in COVID-19 cases. New York City Governor Andrew Cuomo said that indoor dining will come to a halt. The governor also said that rising hospitalizations and New York's high density was the factor of concern. The city will also open a vaccine command center to coordinate distribution throughout the city.
The 170,000 doses from Pfizer that we announced should be here imminently, Sunday or Monday. We also will get 346,000 doses of Moderna on top of the 170,000, and they'll be here the week of December 21. So the vaccine is coming, and we're ready to administer it. Part of the vaccination has to be the fairness of the vaccination process.
For more details, we are now being joined live by Rachel Silverman from San Francisco. Rachel, thanks so much for joining us. Now, before I dive into the vaccine rollout news, another question that I have at this moment is that media reports are now suggesting that the White House Chief of Staff, Mark Meadows, told the Food and Drug Administration's commissioner that he needed to grant an emergency use authorization for the vaccine by the end of Friday, and if not, he needs to resign. This, of course, is a pressure tactic in the global race to defeat COVID-19. Tell us more about this.
A pressure tactic indeed. Well, we are expecting the authorization momentarily. First of all, President Trump this morning lashed out at the FDA in a tweet, attacking that agency's commissioner, Dr. Stephen Hahn, by name for not approving a COVID-19 vaccine faster. He called the FDA a big old slow turtle, flush with funds, but mired in bureaucracy. Then we heard reports, the ones that you mentioned, that President Trump's Chief of Staff, Mark Meadows, told Hahn that he should either greenlight the vaccine today or resign. Now, it's a foregone conclusion almost that the regulators will approve it. They're now racing to complete a fact sheet with information for physicians and other required documents that go with the authorization.
Right.
Pfizer will also need to review certain documents, and that's the position we're in now.
Right. Now, Rachel, is there a fear among the public and also some health experts in the United States that the country and the administration could be rushing to approve a vaccine given the health crisis that it is facing as of now due to coronavirus?
Right. Well, the timing of this announcement appears unlikely to speed up the shipment of the initial doses of this vaccine that people are waiting for. But you are absolutely right to suggest that there is some feelings of doubt among the public about whether or not the vaccine approval has been rushed through. About half the population in the United States has said that it's reluctant or will not take the vaccine, and this sort of rush job that the president is asking the health officials to do does not seem to be bringing any more confidence to the American public about the vaccine.
Right. Now, assuming that the vaccine gets approved next week, do we know who would get priority and what would be the rough cost of the inoculation in the U.S.?
Right. Well, the cost is one thing. We expect that the vaccine will be free for Americans. The first people to get the vaccine will be frontline health workers. The second people to get the vaccine will be some 3 million elderly who live in nursing homes and the people who take care of them. The third people to get the vaccine will be what we call essential workers, but it's going to be some months before all Americans get this vaccine. It will be certainly until the springtime before everyone will be able to get an inoculation.
Right. My final question, Rachel, given some of the evidence that has come to light in the past few days, is there also now a strong lobby against using a vaccine, given how little we know about its long-term side effects?
Well, there are a lot of people who wonder whether or not there will be long-term side effects. The vaccines have not been, clinical trials have not been done on children under the age of 16, for instance, on pregnant women, breastfeeding women, people with severe allergic reactions to drugs. So those people will, there will be a policy that will be made for people like that, but those people are among the people who are most reluctant to take the vaccine. But, this is a disease that's already killed hundreds of thousands of Americans, and we expect to lose, on average, 3,000 Americans a day until we develop herd immunity, probably, hopefully, sometime this summer.
Absolutely, Rachel. That is the hope. Thank you so much for joining us on this broadcast and for all your insights.